Is therapy important, Mavu? If so, what is the right sort of therapy to go for? What criteria should you be looking for in your therapist? Just talk us through that whole landscape, if you would.
Okay, so the first thing is, obviously I'm going to sound biased about this because I am a therapist. So of course I'm a firm believer in therapy. For the record, obviously when I'm working my day job, there is strict criteria. So it's not about whether or not I think, therapy is great for everyone. It's actually, we need to be able to say you've got this diagnosable difficulty, but that's because I work within a national health service, so we can't see everyone. We need to draw some lines. For day-to-day life, if people could afford it, I would really strongly advocate that people have therapy. And it's any type of therapy. I advocate individual therapy, so you work on your own stuff, because we all have stuff, if that makes sense. There's no such thing as I had a perfect childhood, because the minute you start unpicking your childhood, you might find some unresolved stuff. Now, that doesn't mean that stuff is there to drag you down. It might be some learning that's useful for you to understand yourself for relationships you are going to have in future, if that makes sense. And so a common thing, for example, is sometimes I've encountered young people who talk about, oh, my childhood was great, my life was great, relationship with my parents was reasonable, my mom and my dad loved each other, and then they start talking more, and actually turns out that there may be specific defined roles in the family, and you try to get them to sort of unpick and go, how would you feel if your partner expected you in your relationship to have the role that your mother had? And so it's all well and good to go, actually, I don't have anything to talk about. But if you don't address how you feel, apart from, thinking of it as a child and going, my life was great, if you don't address how you feel about it as an adult, your childhood, how you reflect on it now as an adult, then that can have a bearing on the relationships that you find yourself in, and whether or not you end up a victim or a perpetrator in a relationship, if that makes sense. So I always say therapy is good, and it doesn't have to be individual therapy. I recommend therapy even in relationships, premarital therapy, post-marital therapy. Don't wait for there to be problems. And it's really important. I think there was another one that I watched, one of you, where we talked about getting to know your therapist, because the most important part of therapy is, I kid you not, of course, I'm not undermining, the years I spent studying, and not undermining my MSc and things like that, not at all. But I know from the evidence that I did write a paper on the therapeutic relationship as the best indicator for successful outcomes. So the relationship, more than anything that your therapist can tell you, is the most important part of therapy. Now, if you wait until there's a problem, and then you try telling someone a profound problem, it takes a while to be able to open up. If you've had weeks or months of, coming in and going, oh, I hate my job, because that's a minor issue to you, it makes it easier to go in and go, actually, my husband is cheating, or I think he's cheating, because we're not necessarily comfortable with that kind of deeper stuff. I've just met you. How do I start telling you all these things about myself? Sure. That's where the therapeutic relationship comes in. The modality, I hope that's answered it, that it's less important unless there is a specific presentation. So of course, for some things, if you're coming for treatment, which is different from if you're coming, to find yourself and discover yourself and all that thing. If you're coming for treatment, then I might say to you, actually, let's start with interpersonal, therapy, because you've told me that your depression is rooted in difficulties with your family. Or actually, if it's about you, then we might go, let's go cognitive behavioral. So that will determine the type of therapy. But if there's no problem and you're just wanting it to find yourself, actually, it's more about your therapeutic relationship. Go for it, find out.